and welcome. I'm Olivia, your safety trainer, here with today's lesson on office ergonomics. Before we begin, remember to sign off on your mobile device or online to receive credit for this training. If you feel the need to pause this video at any time to have a discussion, we encourage you to do so. While working in an office may not be as strenuous as other occupations, your body can still experience health problems when improperly sitting or lifting items. In this lesson, we'll cover the musculoskeletal disorder hazards of not sitting or lifting properly, ergonomic tips for use when sitting at a desk, and potential alternatives for office use. When most people hear of musculoskeletal disorders, they may think of people who work in construction, manufacturing, or warehousing, or other labor-intensive work. While common in these industries, they are also commonly experienced by many office workers. So, you may be wondering, what exactly is a musculoskeletal disorder? It's an injury or disorder that affects your body's movement or musculoskeletal system. This includes muscles, tendons, ligaments, nerves, spinal discs, and blood vessels. Musculoskeletal disorders, as with other health issues, have certain symptoms associated with them. These symptoms may develop over time and include numbness, burning, pain, tingling, aching, or stiffness in parts of the musculoskeletal system. Common disorders associated with office work are carpal tunnel syndrome, tendinitis, tennis elbow, tension neck syndrome, or trigger finger. Your risk factor for developing a disorder depends on what you do at work and how long you're doing it. Avoid prolonged sitting in awkward positions, repetitive motions, prolonged static postures, twisting of the wrists and other joints, slippery floors, and any other forceful exertions. One thing to remember is that many disorders are preventable by working ergonomically. For office work, this means working in a neutral posture while sitting at your desk. This includes choosing and using an appropriate chair to support your spinal curve. The chair that you choose should be able to be adjusted so that your feet can rest flat on the floor or on a footrest. If your chair does not support your spinal curve, you can use a lumbar support pillow. I know it might kill some of you, but you should also be properly sitting in your chair. This means that your feet are flat on the ground, or if your chair is too high using a footrest, your shoulders are relaxed and your elbows are bent at a 90-degree angle in a resting position. Sit in a position that supports your back. To achieve the best sitting position for you, you may need to lower or raise your chair or desk depending on your height. Using an appropriate desk. A good desk allows clearance for your knees, thighs, and feet. If your desk has no adjustable feature, you can raise it by using sturdy boards or blocks. If the desk is too high, you can raise your chair. Keep objects that you use most of the time, including telephones, staplers, and printed materials, close to your body to minimize reaching. Adjust your keyboard and mouse so they're easy to reach and are level with your hands and elbows. Your wrist should be as flat as possible when typing. Position your monitor so that it's directly in front of you. Many ergonomic experts suggest that it should be around an arm's length away while in a sitting position. The top of the screen should be at your eye level or a little below, with the keyboard directly in front to minimize how frequently you turn your neck. Additionally, it's recommended that the monitor be placed in an area that will minimize or eliminate screen glare. This will help with eye strain. Use a headset or speaker if you're on the phone for large portions of the day. Cradling the phone between your head and neck can contribute to neck strain. It's also recommended that you take breaks from the computer by doing other tasks such as copying, stapling, or speaking with a coworker about job-related tasks. Small breaks are also advised, such as taking a minute or two to stretch or taking a walk during allotted break times. You can also minimize your chances of developing a disorder by drinking plenty of water throughout the day, getting plenty of exercise, and eating a balanced diet. If you're having to lift objects such as boxes, remember to lift them in an ergonomically friendly manner. For more on proper lifting techniques, please refer to our lifting lesson. help offices with ergonomic practices, many manufacturers have products that your office may consider using, such as kneeling, saddle or exercise ball chairs, and adjustable standing or treadmill-style desks. While these help some people, remember that everyone is unique, and not all solutions will apply to you. If you're using one of these alternatives and you find that you're not sitting in a comfortable position, please speak with your supervisor. To conclude, while working in an office is less hazardous than other occupations, office workers are still prone to developing disorders over time. To help reduce your risk, make sure to practice proper posture and adjust your work area to your needs. If you have any questions on what you can do to make your space ergonomically friendly, or this lesson in general, please ask your supervisor. Once again, remember to sign off on your mobile app or online to get credit for this lesson. I'm Olivia, your safety trainer, reminding you to be careful and stay safe out there. Thanks for watching.